Welcome back to News This Week in Nursing Homes. I'm Nurse Thug. First up, CMS finalizes controversial 80-20 rule. CMS finalized the controversial Medicaid Access Rule, including the contentious 80-20 provision, amid strong opposition from providers. The provision mandates that 80% of Medicaid payments for services go directly to workers' wages to ensure fair compensation. Industry leaders criticized the rule, expressing concerns about potential impact on access to care and financial strain it may impose on providers. They argue while the rule intends to raise workers' wages, it could lead to agency closures, reduced services, especially in rural or underserved areas. Providers are pushing back, calling for more feasible solutions to address low compensation without compromising access to care. The industry anticipates challenging transition period ahead as they navigate compliance with the new rule. Next, Extra. CMS publishes rule outlining final staffing requirements. CMS announced exemptions for nursing homes regarding RN coverage, allowing up to 8 out of the 24 hours without RN presence under certain circumstances. The DON can fulfill 24/7 RN requirements, alleviating some challenges in recruitment. The White House increased daily direct care to 3.48 hours per resident, specifying 0.55 hours for RNs and 2.45 hours for CNAs. The 329-page rule emphasizes evidence-based standards, highlighting care, quality, and safety. Providers voiced concerns about staffing, financial strains, and lack of support for staff recruitment and training. CMS detailed exemptions based on the area nurse-to-population ratios, granting waivers for facilities meeting specific criteria, and documenting recruitment efforts. The rule's staggered implementation aims to assist rural facilities over the next 5 years and non-rural ones in the next 3. Associations urged robust funding and strategic efforts to meet staffing mandates effectively. Providers. Staffing rule is a fairy tale that'll exacerbate nursing home access issues. Federal regulators issued nursing home staffing mandate increasing the required time per resident per day from the 3 to 3.48 hours split between RNs and CNAs. Despite exemptions allowing LPNs and LVNs to contribute, providers expressed dismay at the intractable stance, citing ongoing labor shortages. CMS maintained 24/7 RN standard, exempting up to 8 hours of RN coverage under certain conditions. Critics highlighted the rule's lack of funding for RN wages and recruitment, foreseeing challenges in meeting mandates. Providers emphasized the impracticality of the rules, especially in rural areas. Associations and lawmakers are split on the rule, with some praising its focus on resident safety, while others criticized its potential impact on staffing shortages and nursing home viability. Concerns arose about consumer confusion and confidence in care quality. Providers must now navigate the rule's detailed requirements, including evidence-based facility assessments and acuity-based staffing plans, within specified timelines and workforce challenges. Next up, SNF VBP program Early Look Performance Score reports are now available. The Early Look Performance Score reports for fiscal year 2026 are accessible through iKeys. This expansion evaluates performance across various QFs, intending to familiarize SNFs with report formats, scoring, payment methods, and historical performance to model future outcomes. CMS invites stakeholders to a National Nursing Home Stakeholder Call on April 24, 2024 at 2:30 p.m. Eastern Time, open to LTC providers, facility staff, and resident advocates. The reports serve 3 key purposes: introducing SNFs to the official report format, explaining scoring and payment approach for fiscal year 2026, and providing insights to the past performance, projected outcomes for the year. See the link below for more info. And last, Measles, posing intensified threat to nursing home residents and personnel. Measles outbreaks in numerous U.S. states, the highest since 2019, pose significant challenges to nursing homes. Many rely solely on MMR vaccines, yet neglect to track community vaccination rates. Rising anti-vaccine sentiments emphasize the need to monitor facility immunization coverage, a task facilitated by dedicated infection preventionists. Even one measles case can severely impact community health and nursing home operations, particularly in today's staffing crisis. Nursing homes must partner with local health officials, maintain clear communication across leadership levels, and utilize airborne infection isolation rooms during an outbreak. If unavailable, residents should be transferred to a facility with adequate cautions. Thanks for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.